Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Here's what I bring to you from the world of medicine. JAMA study finds existing blood pressure drugs may prevent epilepsy. Stanford medicine researchers and their colleagues have discovered that a class of drug already on the market to lower blood pressure appears to reduce adults' risk of developing epilepsy. The study published in JAMA Neurology suggested that the drug called angiotensin receptor blocker could prevent epilepsy in people at highest risk of the disease, including older adults who have had strokes. Epilepsy, often diagnosed in childhood, also affects over 1% of people over age 65, with seizures disrupting brain function and causing various symptoms. In older adults, stroke is a leading risk factor for epilepsy, with 10% of stroke survivors experiencing seizures within 5 years. Vascular disease and chronic high blood pressure further increase the risk. While anti-seizure medication control epilepsy after diagnosis, no drug currently prevents it in high-risk individuals. Recent studies, however, suggest that certain blood pressure medication might help prevent seizure by reducing inflammation, particularly in cases following stroke or traumatic brain injury, which can trigger epilepsy.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
No major birth defect linked to paternal metformin use, according to a study. A study published in Annals of Internal Medicine found that paternal use of metformin monotherapy was not associated with major congenital malformations in newborn. Associations between metformin and polytherapy and birth defect could potentially be explained by worse underlying parental cardiometabolic risk profile of those taking multiple diabetes medications. Paternal use of metformin involves men taking the medication often to manage type 2 diabetes during the period of sperm production prior to conception. Metformin helps regulate blood sugar level by reducing glucose production in the liver, improving insulin sensitivity and decreasing sugar absorption in the intestines. While metformin is primarily used to treat diabetes, it has also been studied for other potential health benefits. Study reveals risk factors for long COVID. Early in the pandemic, many people who had SARS-CoV-2 infection or COVID-19 began to repeat that they couldn't get rid of their symptom even after a month or more, unusually long for a viral infection of upper respiratory tract, or developed new persistent symptoms soon after the infection cleared. Although it's still not clear what causes post-COVID-19 conditions or long COVID, a new study by researchers at Columbia University published in JAMA Network Open confirmed the high burden of long COVID and sheds light on who's at the greatest risk. The study involved over 4,700 participants from the collaborative cohort of cohorts for COVID-19 research who were asked to report their time of recovery after infection with SARS-CoV-2. The study found that between 2020 and early 2023, the median recovery time after SARS-CoV-2 infection was 20 days, and more than 1 in 5 adults did not recover within 3 months. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.